There are four abdominal quadrants. You have the upper right, the upper left, the lower left, and the lower right. Included in those four quadrants, you have 9 abdominal regions. The left and right hypochondriac region, the left and right lumbar, the left and right inguinal region, and in the middle you have the epigastric, the umbilical region, and then the hypogastric.
All right, so she is standing in anatomical position, which is standing erect with your palms forward and you're facing forward. So next we have anterior, which is would be the front of the body, and then posterior, which would be the back of the body.
Then you have cranial and caudal. Cranial and caudal is usually used for animals. Cranial is towards the head, and caudal is towards the tailbone or back.
Then you have superior, inferior. So her head would be superior to her neck, and her shoulder would be inferior to her head.
Then you have medial and lateral. Medial means towards your midline, which is the middle line that separates your body into 2 equal halves, left and right. So your shoulder would be medial to your elbow, and your elbow would be lateral to your shoulder.
So then you have proximal and distal, which proximal is closer to your trunk and distal is farther from your trunk. So her knee would be proximal to her ankle, and her ankle would be distal to her hip.
Then you have superficial and deep. A paper cut would be superficial to a stab wound, while a stab wound would be deep compared to a paper cut. Then you have your belly button, which is also called the umbilicus. And you have your midline, which is the middle line that separates your body into left and right. Then you have the transverse body plane, which separates your body into top and bottom. And you have sagittal, which is left and right, just like your midline. And then the last body plane is frontal, and it separates your body into front and back.